Picture a patient standing stiffly in the center of an exam room, barely breathing. He refuses to take a single step forward, his posture locked in a state of paralyzing fear. If you approach him, he will beg you not to touch him. He has developed an absolute conviction about his own anatomy. He believes his body is made entirely of glass. To him, tripping on the floor means shattering into 1,000 pieces. This is glassy Gabriel. His immobility is compounded by severe paranoia. He is haunted by the feeling that a phantom companion is walking silently right beside him, matching him step for step. That external dread is matched by a visceral internal sensation. He feels something alive, physically kicking inside his stomach. A patient presenting with these exact symptoms raises a very specific question. What clinical condition produces a reality where the body feels this fragile, and the mind is this consumed by phantoms? Gabriel is trapped inside a highly structured, hyper-fragile psychological prison that aligns with a specific medical anomaly. To find the answer, we have to look away from Gabriel's glass-like mind and examine the grounded reality of his physical body. A physical exam reveals a state of decay. His skin is a garden of warts, seedy, pedunculated, and prone to bleeding. There's a localized anomaly with his sweat. It carries the distinct smell of honey, but this only manifests on the parts of his face that are left uncovered. This diagram shows an inverted pattern of dental decay. Rather than starting at the top, the rot originates deeply at the hidden root and spreads upward, leaving the visible crown untouched. His urinary symptoms follow a similarly specific pattern, a split stream that culminates in a sharp, knife-like pain on the very last drop. These physical abnormalities form a distinct map. These structural breakdowns converge into a single underlying condition. The decay within Gabriel's body gives us the baseline, but we also have to account for the external catalysts that trigger his breakdown. Reviewing his history shows a clear point of origin. His systemic decline began immediately following a vaccination. This points to a physiological constitution defined clinically as hydrogenoid. His body is violently reactive to moisture in any form. This chart tracks the correlation between his environment and his symptoms. For a hydrogenoid patient, the appearance of a single rain cloud triggers screaming, severe rheumatism. Gabriel's decline relies on the collision of medical history and atmospheric moisture to reach its full destructive potential. The delusions, the physical ailments, and the reactions to moisture are not anomalies. They are components of a mapped clinical profile. This diagram connects the phantom glass limbs, the bleeding warts, and the extreme sensitivity to moisture. All three pull toward the same center. They point to the clinical identity, Thuja Occidentalis. Outside of medical taxonomy, this is known by its historical title, the Arbor Vitae, or the Tree of Life. There is a paradox at the heart of this diagnosis. A profile defined by physical decay, mental fragility, and fixed illusions bears the name of the ultimate symbol of vitality. The Thuja Occidentalis profile bridges the gap between psychological fear and visceral reality. It shows how a mental delusion is anchored by the failure of the physical body. The case of glassy Gabriel serves as a mirror, showing what happens when the human mind and body fracture in total, synchronized harmony.